reported today in The Verge. There's no quick fix to find racial bias in healthcare algorithms. Legislators in Washington, D.C. are taking a closer look at racial bias in healthcare algorithms after an October analysis found racial bias in a commonly used health tool. Senators Cory Booker, DNJ, and Ron Wyden, DR, released letters on Tuesday calling for federal agencies and major health companies to describe how they're monitoring the medical algorithms they use every day for signs of racial bias. Unfortunately, both the people who design these complex systems, and the massive sets of data that are used, have many historical and human biases built in, they wrote to the Centers for Medicare and Medicaid Services, CMS. The senators' focus for their letters was mostly on gathering information. They wanted to know if the CMS, which administers Medicare and Medicaid, is collecting information from healthcare organizations on their use of algorithms. They asked the Federal Trade Commission if it was investigating harm caused by discriminatory algorithms on consumers and asked the health companies, including Aetna and Blue Cross Blue Shield, if and how they audit the algorithms they use for bias. Equity in healthcare depends on identifying and rooting out bias in algorithms. But because the programs are still relatively new, there still aren't best practices for how to do so. These practices bubbling up are more like best efforts, says Nicole Turner-Lee, a fellow in the Center for Technology Innovation at the Brookings Institution. There are tools designed to detect bias in algorithms, as the senators note in their missives, built by private companies like IBM and nonprofits like the Alan Turing Institute. But they're not perfect solutions, and they don't weed out all of the potential sources of bias. Running algorithms through their checklists should be done routinely, says Brian Powers, an internal medicine physician at Brigham and Women's Hospital and author on the October racial bias paper. But that won't get you all the way there. The October study, for example, identified a bias that wouldn't be found by an automated detection system, Powers says. The algorithm it analyzed is designed to flag patients with complex healthcare needs, and it uses the cost of care as a proxy for how sick they are. The algorithm itself was unbiased, but using cost prediction as a way to flag patients was biased because white patients are given costlier treatments than black patients. Just looking at the algorithm alone wouldn't have identified the issue. What we uncovered wasn't in the algorithm and its ability to do what it was trained to do, but in the implementation, and the choice to use cost as a proxy, Powers says. Bias identification tools can help to make algorithms and artificial intelligence tools more accurate, but they don't necessarily tackle. For more on this story, visit the news article link.